Have you ever wondered why you struggle with weight? Are your menstrual cycles irregular or even absent? Have you struggled with foggy brain? You may have something called PCOS. That's what we're going to be talking about in this episode. If you're new to this channel, I'm Dr. Dwain Woode, an endocrinologist, and I help people understand their bodies so they can take charge of their health, avoid complications, and live healthy, fulfilling lives. Let's get started. We are so glad that you are here for this episode. We're going to be talking about PCOS, or polycystic ovarian syndrome, which is a hormonal disease that affects between 5 and 26% of all the women on the planet. But before we get there, if you are getting some benefit from our channel and the videos that we're doing, if you've not already done so, please go ahead and hit the subscribe button and hit the bell so that you will be alerted to new content that we provide. If you've already subscribed, go ahead and give a thumbs up to this video, like it, and share it with your family and with your friends. So what is PCOS, or polycystic ovarian syndrome? PCOS is the most common cause of infertility in the world, affecting between 5 and 26% of all women of reproductive age. Although PCOS is commonly diagnosed during the reproductive age, its effect can be felt in adolescence as well as late into menopause. The exact cause for PCOS is not known, but there are some factors that may play a role. One is excess insulin. Insulin is the hormone that helps your body regulate its glucose levels. Excess insulin seems to make it difficult for ovulation. The next is inflammation. So inflammatory cells in the body usually fight infection. And for some reason, this inflammation, this low-grade inflammation, causes the ovaries to begin producing too much of the male hormone, or androgens. There's also a genetic component, so that women who come from families where there is a history of polycystic ovarian syndrome tend to be predisposed to also having polycystic ovarian syndrome. And then finally, excess androgens. Androgens are the male sex hormone, and for some reason the ovaries begin producing too much of this hormone. So that cluster of factors seems to promote this polycystic ovarian syndrome. So there are 3 criteria that are used to diagnose polycystic ovarian syndrome: excess male sex hormone, or androgens, called hyperandrogenemia; polycystic ovaries, or multiple cysts in the ovaries; and oligomenorrhea, meaning decreased menstruation, or amenorrhea, meaning no menstruation or no menstrual cycles. Oligomenorrhea is defined as having less than 9 cycles per year. So what are some complications of polycystic ovarian syndrome? The first would be infertility. So because of these oligomenorrhea or amenorrhea, that is decreased cycles or no cycles, then fertility may be difficult. 50% of patients who have PCOS can go on to develop type 2 diabetes. Women can also have gestational diabetes. Their weight can increase, so obesity. They can have hirsutism, which is abnormal hair growth on the chest, the chin, around the lips. They may also develop male pattern baldness because of the excess androgens. Sleep apnea has also been associated with PCOS, and also these women can go on to develop uterine cancer. So symptoms of polycystic ovarian syndrome would be weight gain, excess hair growth, as we mentioned before, hirsutism, irregular menstrual cycles or absent menstrual cycles. People can have mood changes or mood disorders. Depression is very common. Skin conditions such as acne and oily skin, or acanthosis nigricans, which is where there is thickening of the skin because of the excess insulin. So the diagnosis of polycystic ovarian syndrome begins first with a visit with your healthcare provider. They will need to get a good history and take a physical exam. They will probably order some blood work to look at your androgens to see if those are elevated. An ultrasound will probably be done, a pelvic ultrasound, which shows whether there are cysts in the ovaries, and then also discussing your menstrual cycle history. So what is the treatment for PCOS? Well, there are several things that can be done. Number one, we talked about the insulin resistance or excess insulin that is present. One of the very first things that can be done there is to work on managing weight. Many of the patients who have polycystic ovarian syndrome also have an elevated BMI and have metabolic syndrome. So metabolic syndrome is a constellation of characteristics that will predispose someone to having not just polycystic ovarian syndrome, but also predispose them to other illnesses or other conditions such as heart disease, non-alcoholic steatohepatitis or NASH, high cholesterol, high blood pressure. So all of these things are constellations that fit into this metabolic syndrome that also will be complications that someone can see with polycystic ovarian syndrome. Metformin has been shown to help with the hyperinsulinemia and has been shown to also help regulate menstrual cycles. For women who are not interested in pregnancy at this time, they can be started on birth control, and that will help to regulate menstrual cycles. It will help to balance out the hormones. And then for people who have hirsutism or excess and unwanted hair growth, then spironolactone is one of the things that's used because it decreases the androgens and helps to relieve the hair growth. So our challenge in this video is if you're having any of those symptoms, if you know someone who's having any of those symptoms, get them to see their healthcare provider. Remember, we are trying to educate you so that we can minimize complications and help you to live a healthy, productive, fulfilling life. If you've not already done so, please go ahead and hit our subscribe button, hit our bell, give us a thumbs up, like our video, share it with your family and friends, and we look forward to seeing you at the next video. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away, educating the public for a better you.